The Health Minister, who's Dr. Aaron Motsoaledi, he is today expected to visit Northwest to assess flood damage at several hospitals. 3 hospitals have been severely impacted by torrential rains that have battered parts of the province. Refiloe Seboko is tracking developments in Lichtenburg and joins us live. Refiloe, very good afternoon to you. How much of an impact have these floods had, especially on those in those hospitals, in terms of the services that need to be put out to citizens?
Well, Katlego, the situation here at the General de la Rey Hospital in Lichtenburg, the impact is that the hospital had to be temporarily closed, partially closed, but also forcing, the Department of Health to take a decision to remove patients that were admitted here, some also being transferred to other healthcare facilities. About over 30 patients that were here at the General de la Rey Hospital in Lichtenburg, we saw them, or rather they had to be transferred to other hospitals, and that is the impact as a result of the heavy downpours causing flooding to this hospital, which is said to be the one that is badly affected compared to the Moses Kotane Hospital in Rustenburg, also as compared to Zeerust Hospital at the Ramotseremira local municipality. But like you indicated, that here at the Litsobotla local municipality, here at the General de la Rey Hospital, Dr. Aaron Motsoaledi, I can confirm that he has arrived. In fact, about an hour or two, about an hour back, he has arrived here at the General de la Rey Hospital, still locked in meetings with the MEC of Health in the Northwest Province, together with other officials, getting a briefing in relation to what really happened. Before, he will be talking to that which has been shown, but also what the plan, the intervention plan should be. But I'm going to speak now to SANCO to tell us about their reaction to what is happening in the hospital, but also, Ernest, what is your reaction to the situation that these hospitals, General de la Rey Hospital, is finding itself in now?
Good day to listeners of Newzroom and to everybody. We as SANCO were very disappointed and very disappointed about the situation that is taking place in General de la Rey Hospital. This hospital is an integrated hospital that must accommodate 7 pillars of local municipalities. But with the current status, it's not supposed to be the hospital that can accommodate those 7 integrated pillars of local municipalities, because the situation is dire here. In fact, previously there was a suggestion with the previous MEC, which is Honorable Madoda Sambata. There was a say that this hospital must be closed and be converted to clinic. There was a new hospital that was supposed to be built next door. But to our surprise, we are still surprised that the hospital is still existing, and then there is a poor state of infrastructure. Secondly, there is poor state of administration. The West, there is a lot of corruption that is taking place in terms of tender processes that are taking place in this department.
You were saying that this is not the first time this hospital is experiencing flooding and having impact on incidents. Talk to us about some of the incidents that you've been aware of and the concerns that you have raised as SANCO, the responses thereof.
Since 2015, 16, 17 till today, we have been complaining about the general status of the hospital. Because remember, this hospital was built in 1955. So the infrastructure of this hospital was never, ever improved since then. It has only been tenderpreneurs who have been coming up here as tenders, but not doing quality jobs. We can go inside and check in terms of human resource. There are lack of beds, there are lack of infrastructure taking place in the hospital. As we can move around and check, there is no infrastructure in terms of water reticulation systems. That is why we find this situation taking place today, because this is a long-standing out problem
We are now talking about flooding as a result of heavy rain, but also not that. Yesterday when we were talking up to the department, to the municipality, indicating that the blockage of the drainage system, admitting that it is the cause of the hospital flooding, in fact also affecting services.
Yeah, to be honest, as communities, we are aware of the corruption that is taking place within our municipalities. And that affects also the infrastructure development in terms of the entire region. In particularly in Ditsobota, there is instability in terms of political situations. Those very same political situations are leading to the poor services. That is why you find that there is no service delivery. And that service delivery, it affects state institutions like this hospital. Because once the municipality is not stable, automatically the services will be poor in terms of development of our own communities and state hospitals.
The minister is here to assess the situation, but also to have an intervention plan into ensuring that things are back to normal. We also know that when we spoke to the MEC, indicating that repairing and fixing is expected to start tomorrow, or the contractor is expected, the service provider, to start tomorrow, with full operation being expected to get in place over the weekend. What do you have to say in relation to what the intervention plan should be it the temporary, short-term or long-term, in relation to the state of facilities, health facilities in the province as a whole?
We are happy that the minister will be coming here to assess the situation together with the MEC. But generally, our view as SANCO, there is a dire need from national to come up with a better approach in terms of how to deal with public hospitals in the province. Because previously, you must remember, all these hospitals that are available here, they are from the old regime. We don't have the current developed hospitals in terms of the new regime, particularly here in the district of Ngakamuti-Remolemo. Go to Klerksdorp or Potchefstroom or Vennesdale. The status of the clinic is far better than the status of this General Delrayville hospital. In fact, this was supposed to be a clinic, not a hospital. Now we are saying to the minister, since they have introduced national health insurance, they must now come up with new advanced hospitals that are going to improve the life conditions of our people, particularly in this region of Ngakamuti-Remolemo.
And what do you think as SANCO should be the plan, so that we are also talking to the NHI for it to be able to work accordingly? What should really happen in ensuring that our healthcare facilities are operational and accurately so servicing our people?
Our solution is very clear, SANCO. When we want to implement national health insurance, all the stakeholders must be integrated in one combat, meaning all the stakeholders must have regular meetings with private sector to can assist to implement that particular program. Because without the stakeholders, this NHR issue won't be implemented properly. It will lead us to collapse of health systems in the country, particularly in our province.
And your concern as SANCO was also is that community members' patients are affected. I mean, we saw others having to be transferred, others, just having challenges. What is of your concern as SANCO when it comes to community members and that which you've also noted?
Our concern as SANCO, our patients are suffering. You must remember we are the poor of the poorest in this region. Now, the challenge is that when we move from one place to another, is resources. And the state of our people here in our region is dire because we are the poor of the poorest. We are saying to government, let them now start to approach things with communities. They must take resources of government nearer to the people so that there can be less expense and less corruption in terms of processes.
Thank you so much for your time. There you have it, Katlego. We are just waiting to hear what the minister will have to say in terms of the intervention plan with regards to the flooding that has caused damages and the damages that they've been able to identify. As soon as they are done with that meeting, we also understand that they are still locked into that meeting so that he can be able to get a proper briefing in relation to what has happened. What I can tell you here at the General de la Rey, there has been able to be a mop-up operation. There is no water that is flowing. There was just a concern that earlier on there seems to be heavy rain, though the clouds are now starting to clear. But it's just a concern. Another thing is that even with the facilities that they have been identified for community members to be able to go to, and so that health services should not be affected. Others are also complaining about not being able to travel there or having transport to go there, or just having the financial means to be able to travel to those facilities.
All right, Refiloe Seboko, we'll certainly get an update from you once the minister is out of that